Hello, welcome to part 2 of Ideal Age for Breast Reduction. In part 1, we have covered the teens and the younger age group. Now, we will be looking for the older age group. Hello, I'm Dr. Sheetal Londhe. I'm a board-certified plastic surgeon practicing at ZeroSize, Vimannagar, Pune. Many patients come to me with a question, ma'am, am I too young for a breast reduction surgery? Or the older ones, am I too old for a breast reduction surgery? Breast reduction surgery is not depending on your age. It's depending on the symptoms. Because as I told you, it is just not a cosmetic surgery. It is a surgery to relieve your symptoms. Now, what does an enlarged breast do? In teenagers or even in older people, even in fact in the younger group, it causes discomfort by causing back pain, neck pain. Sometimes it also have shoulder grooves because of those heavy breasts holding on a wide strapped bra. Then there is discomfort in different physical activities. Teenagers cannot take part in the sports that they want only because of this breast. Youngsters don't get clothes of the design or the attire that they want. They cannot dress into it. So, and in older age, that heavy breast makes it difficult for mobility. Then, how do we categorize? Patients coming to me come from age group of 11 to the age group of 65 and 70. Now let me brief you specifically related to this age group. The most common age group that comes is between 20 to 35. But let us start with the younger group. Girls in the age group of 13 to 20 also come to us concerning the heavy breast or the large breast volume. See, breast is developing faster and some of them may have a genetic concern or hormonal imbalances which can lead to an enlarged breast, which is called as gigantism. Or the breast develop too much and the girl is still leaner on her body. So they can consider breast reduction. So parent consent is very important in girls below the age of 18 years. If you ask me, in my practice, I usually do not operate on girls below 18 years, even if they are complaining about a heavy breast, because I find them not mature enough to take that decision and that surgery hours and the recovery period. But I have done a few out of exceptions. They were national players in some sports, or the pain was so much that they were going towards cervical spondylosis. And these were all patients with hormonal imbalances. So we have also done an endocrinologist consultation, taken care of the hormones, and because even after giving hormone, this breast is not going to get reversed and get smaller, so we have planned for a breast reduction surgery. Then after this age group, which is the most delicate age group and most tender to understand also and to convey them what they need, comes the most mature group, and that is the age group between 20 to 35. 60% of my breast reduction patients are in this age group. Why? One thing, the breast is completely developed and then they know what they are suffering for last few years. They have clear ideas about what they require from their body. Career is growing. They are getting many opportunities to go around, but because of this heavy breast, there are hindrances that are coming. So psychological issues are there, physical issues are also there, and physiological issues are also there. So when these all three are addressed in this age group, we can perform a breast reduction surgery in them. It's a very safe procedure, and this age group takes it very nicely and understands what they are going to go through and what they are going to get, and their expectations are realistic as per the consultations. So in this age group, there are few which are very younger, who have not got married or not breastfed, and also those who have had the pregnancies. So it's a mixed group that comes into 20 to 35. Now, does every patient that come to me in this group we advise for a breast reduction? No. If the girl is planning her pregnancy within the next 1 or 2 years, we do not allow them or we deny them from our side to undergo a breast reduction surgery. Why? Breast reduction surgery is not a procedure that can just be done and in a month you will heal. Yes, it will heal, but then you're going to go in your phase of pregnancy where the breast is going to develop again, have the changes. The internal scars are still healing. As I told you in my prior videos also, that a scar maturation time is 18 months, that is 1.5 years. So when your external scars heal, there are some internal scars also in a breast reduction surgery which has to heal. So if a female is planning her pregnancy in the next 1 or 2 years, I would always say, beta, finish your pregnancy, enjoy your motherhood, breastfeed your baby, and then come to us. So in this age group also, as I told you, I have mixed population, married, unmarried, breastfed, unbreastfed, and all those. And then comes the other group, that is 35 to 50. Okay, now as I told you, 60% of my population in my consultation is between the age group of 20 to 35. But 70% of the surgeries that I perform are in this age group. Why? One, they have finished their families and now they are ready for whatever changes they want in their own body. They want themselves back. Second, this pregnancy just not causes the breast to enlarge more. It also causes asymmetry and it also causes stenosis, that is sagging of the breast. So all three things have been taken care in patients who have finished their family life and also requiring breast reduction. So we do a breast reduction surgery, we do a breast lift surgery, and we will correct the asymmetry also. This age group is very common. They are mature enough to take their decisions, and we are also confident enough in doing their procedures, because when it is both the parties are ready for that procedure, they have come for a common decision, it is easier for the patient and also for the surgeon. Now, there is an age group which is, very small related. Very few patients come in that age group, but they do come, and that is above the 50. They've had their families, they've struggled with that breast, wearing all types of, dupattas and pallus and all, and they've covered it. Now kids are open, grown up and everything, but still they have the discomfort. They have now got diabetes diabetes and some of the other, age-related diseases, and still they are struggling with those heavy breasts. Fungal infection is coming in the under area of the breast. They cannot walk. Now knees are also getting weaker. Walking is getting difficult. Climbing steps is getting difficult, all because of these heavy breasts. This age group, I feel, that we should do breast reduction in them, not only because it's a cosmetic procedure, but their life, which is required to get more energetic. They need to do more exercises in that age group to build their muscle and the bone density. These breasts can hamper them. So breast reduction above age of 40 is also very much advisable if it is causing any symptoms. So as I told you, breast reduction surgery has no specific age group, whether we can do in this and whether we cannot do in this. The way I have explained you in these 4 age groups, any patient who is really suffering from those heavy breasts and symptoms related to it need to get a breast reduction surgery. Breast reduction surgery is not just a cosmetic surgery. It is a surgery to not only increase your confidence, as I say that your body gives you the confidence, but it is also for the physical mobility that is required to get rid of the heavy breast. As we have seen in part 1 and part 2 of ideal age for breast reduction, if you fall in any of this age group and you have concerns regarding your breast size and reduction, then please feel free to contact us at ZeroSize, Viman Nagar, Pune.